Hello everyone. Today we are going to learn another interesting and informative session on chest drainage and chest tubes and what are all the nursing skills we have to do during the procedure. Are you all ready to listen? Yes. So what is the learning objectives of this session? At the end of the session, you will be able to define what is chest drainage, what is the concept of chest drainage, how the chest drainage is performed, and explain the indication for chest tube insertion, and you will be able to identify the parts of the chest drainage system, and you will be describing the nurse's responsibility before, during and after insertion of ICD, and recognize complications and emergency management, and you will be able to demonstrate safe nursing practice of patient with chest drainage tubes. So these are the expected learning outcome out of this session. Coming to the introduction, what do you mean by chest drainage? So the name itself simply says that drainage is nothing but letting out something, right? So chest drainage means letting down or letting out of air or blood or pus or excess fluid from the pleural cavity using a chest tubes which is being connected to the drainage system is called as chest drainage. Clear? So drainage means letting out some sort of air or some sort of blood or pus or excessive fluid from the pleural cavity from the chest wall using a drainage system is called as chest drainage. Clear? Once again I repeat, chest drainage is the process of removal of air or blood or pus or fluid from the pleural cavity using a chest tubes which is being connected to the drainage system. Okay, what for we do this? For what are all the purposes of doing this chest drainage? Because it restores the negative intrapleural pressure. Usually the lung will maintain negative pleural pressure. So by doing ICD we can able to maintain that negative pleural pressure. So what happens when the air or blood or pus or fluid get excessively accumulated in the pleural space? What will happen? It creates positive pressure. Thereby the patients will have breathing difficulty on all those stuffs. In order to maintain or restore the negative intrapleural pressure, we need to put the patient on ICD in all these conditions. Second purpose is allow maximum lung expansion. So what happens in case of atelectasis or lung collapse? So the fluid, the excessive accumulated fluid around the pleural space will pushes the lung back and it also makes the lung to get shrinked. So by doing this ICD, we can able to expand the lung and make it in a normal position. And also it helps to improve the work of breathing of the patient. So with the help of this chest drainage tube, we can able to maintain the negative intrapleural pressure, we can allow the maximum lung expansion, and we can improve the work of breathing for the patient. Is it clear? Okay. So we are talking about the pleural space, accumulation of fluid or air or pus in the pleural cavity and so and so. So what do you mean by the pleural space? Where the pleural space exists? Here comes the anatomy of the lungs. I just want to tell you all that we all know. So the lung will be surrounded by a layer which is called as visceral pleura. Yes. So any organ will be surrounded by some sort of thin layer. Same way, lung will be surrounded by a thin layer is called as viscera, visceral pleura. Viscera is nothing but the vital organ and pleura is the covering of the lungs. So visceral pleura is nothing but the pleura which surrounds the lung. Parallelly, we also have parietal pleura that surrounds the chest wall. So in the small picture, you can able to make out very clearly. So this is the one which you are seeing. This is the visceral pleura. Imagine this is the lung and this portion, the region which is surrounding the lung is called as pleura, that is the visceral pleura. Parallelly, we also have parietal pleura. In between this visceral pleura and the parietal pleura, we have the layer is called as pleural space. So that is the pleural space, and there are some amount of pleural fluid existing into the lungs. Clear? So I am just repeating. So the space in between the visceral pleura and the parietal pleura the color which is being highlighted here, right? So that is called pleural space. Clear? So in the pleural space, usually minimal amount of pleural fluid will be passing on in order to maintain or in order to prevent the friction of the lungs. So in order to prevent the friction, minimal amount of fluid will be passing along the external surface of the, the pleural space of the lungs. When it goes beyond, or when there is a blood collection, or when there is a pus collection, or when the pleural fluid is excessive, in such situation, what will happen? It pushes the lung and it will make the lung to get strict, and that's the reason we have to put ICD for the patient. Clear with the pleural space? Clear with the concept of pleural space? This is the anatomy of the pleural cavity. Clear? Okay, let's move on. What are all the indications of chest tubes? So in the definition itself we have seen, right, in which are all the conditions we may put the patient on chest tubes. So these are all the conditions. One is due to air. Patient is having any pneumothorax or tension pneumothorax. What do you mean by pneumothorax? Air collection in the pleural space. So in the pleural space, minimal amount of pleural fluid only will be there. Due to any road traffic accident or chest trauma, what happens? Some amount of air may enter into the pleural cavity. So that will cause the condition called pneumothorax. Clear? Any stab injury or any road traffic accident, any trauma to the lungs will make the air entry into the pleural space. That may make the patient to have pneumothorax or tension pneumothorax. Such situation we have to put the patient on ICD. Second is hemothorax. The name itself suggests that hemo is nothing but your blood. So excessive blood collection in the pleural cavity. When the blood collection will be there, any major surgery, any cardiothoracic surgery or any any surgeries in the thoracic cavity, what happens? The chances of blood collection will be there in the pleural cavity. In such situation, we have to put the patient on ICD in order to drain the excessive blood collection in the pleural space. Clear? What's the third thing? Pleural effusion. We already saw that minimal amount of pleural fluid only will be there in the pleural cavity. When the pleural fluid is extra or excessive, it creates a condition called pleural effusion. In which are all the situation pleural effusion will happen? Patients with any cirrhosis of liver or any liver damage, any renal injuries, or patients with any COPD or chronic lung issues. In such situation, the fluid will get accumulated excessively in the pleural cavity. That will form a condition called pleural effusion. So we have to go for this chest tube drainage system. Next is the chylothorax, accumulation of the chyle in the pleural cavity. What do you mean by chyle? The lymphatic drain. So lymphatic fluid collection in the pleural cavity is called as chylothorax. Then we have something called as empyema. Empyema is nothing but pus collection in the pleural cavity. Pus collection. What happens in case of any tumor of the lungs or CA carcinoma of the lungs or any lung tumor? What happens? There are chances for the pus to get collected in the pleural cavity or any lobe in the lungs. In such situation, we have to do this ICD insertion in order to drain out the excessive pus and in order to treat the patient effectively. Then in other situations like major thoracic surgery or cardiothoracic surgery, so on the safer side, we will be keeping the patient on chest drainage tube to avoid fluid collections or blood collection inside the pleural cavity. Clear? Clear with the indications for chest tubes? One is due to pneumothorax or tension pneumothorax or any hemothorax, pleural effusion, chylothorax, empyema, which is nothing but pus in the pleural cavity, or major thoracic and cardiac surgeries. So these are all some of the indications for us to do chest tube drainage for the patient. Okay? So types of chest tubes. What are all the different types of chest tubes we have? So it depends upon the patient condition and the size of the patient. In case of pediatrics, you may go for this large, small bore ICD tubes, usually around 16 French, and in case of adult patient, we may go for this bigger size of ICD tubes. Next, we have chest drainage system. So in chest drainage system, once we put ICD, we will be connecting it to the drainage bottle, right? So this is the chest drainage system. So we have three chambers. One is the collection chamber, next is the water seal chamber, and third is the suction control chamber. So directly from the ICD, the drain is connected, right? That chamber is called as collection chamber. So in collection chamber, what happens? The excessive drains, that could be either it could be the pus or blood or excessive pleural cavity, it will get drained into the first bottle, first chamber, which is called as what? Collection chamber. Next we have the second chamber is called as water seal chamber, very important chamber. Here we will be filling the half of the bottle with the sterile water. What happens? It creates a pressure, thereby it prevents the re-entry of air back into the lungs. Okay, with the help of suction we are able to suck out the excessive drain from the lungs. With the help of this water seal system, the re-entry of air going back into the lungs will be prevented. So that's the reason we are having this water seal chamber. The third chamber is the suction control chamber. So one side of the tube will be connected to wall mounted suction. It creates some amount of suction in the drainage system, so that the drainage will be very much more easier to get collected from the lung to the chamber. That is the collection chamber. Clear? So this is the entire concept of water seal system. What are the three chambers we have? One is the collection chamber, which is to collect the drainage from the lungs. We have a water seal chamber to prevent re-entry of air going back into the lungs, and we have a suction control chamber which will be connected in the wall suction, and it will create suction, thereby it removes the drainage of chest content. Clear? So in some situation what happens? We will have two chambers. One is the collection chamber and suction chamber. So that will play a major role. So this is a simple example, simple model of the water seal system which will be existing at the practical center. Okay. So principle of water seal, which we have already saw, it acts as a one-way valve, and air escape from the pleural cavity cannot re-enter back into the lungs, and bubbling of the chamber which indicate air evacuation. So this is the simple principle, it works. Okay. So what are all the equipment needed? What are all the articles needed to perform the ICD procedure? When you are collecting the articles, if you remember the procedure, you will never forget to take the articles. You will never forget to miss out things. So you start with PPEs. What the doctor will do? So after hand wash, he will be putting on all the PPEs, right? Cap, gown, mask, apron, all those stuff. So you need to keep the PPEs. Next, you need to collect the you need to take the sterile gloves of the required sizes. Then after putting on glove, what the doctor will do? He will be positioning the patient. So patient positioning. Next, what else you will take and keep? The antiseptic solution. So after positioning, definitely the painting of the region will be done. Since it is a sterile procedure, so they will be painting the required area with betadine or ASP 3000 in the alternative manner. So they have to prepare the skin. For that we need to have antiseptic solution. After painting, what you have to do? The doctor will drape the patient using central towel. So we need to keep the central roll towel. What is the next article? After putting the central towel, what they will do? They will anesthetize the region. So they will give local anesthesia, for which we need to take and keep the local anesthetic agent, usually the xylocaine. Then to withdraw the xylocaine, we need to have syringes. So please take and keep the syringes at the bedside. Then sterile chest tubes of required sizes, and we need to have the connecting tube, the tube which connects the chest tube and the drainage system. So in between we have some tube is called tube is called as the connecting tube, and the drainage bottles or the suction system. Then we need to secure the tube, right? So we need to keep the suture material, and after performing the suturing, we need to put the patient on sterile dressing. So we need to keep the sterile dressing, either Primapore or Medpore or some dressing material should be there. So these are all the articles you need to prepare when the patient is posted for this ICD insertion. Clear with the equipment needed? Okay. So chest tube insertion procedure. During procedure, what happens? These are all the points you need to keep in mind. First and foremost is the explaining procedure to the patient. Very important word. We have been learning this word, but many of the time we may fail to follow this. So always you need to explain the procedure to the patient, though it is being performed by you or the doctor. You have to tell the patient, you have to prepare them mentally in all aspects so that he will cooperate with you very well. So you have to explain the procedure, madam or sir. So some sort of tube will be inserted to you by the doctor in your chest cavity. Since you have breathing difficulty, since you have excessive accumulation of fluid, we need to aspirate it. All those explanation you have to give to the patient, and you have to explain the procedure. Next is obtaining consent. This will be done by the surgeon or the intensivist or the doctor. So we have to ensure whether the consent is taken or not. In order to prevent the legal issues, we have to ensure it. Then position the patient. Usually what position we have to keep? We have to keep the patient on semi-forward position with arm raised above the head, or sitting or leaning position forwarded if tolerated. What for we give this position? For maximum lung expansion and easy visibility of the location. Then after that, what you have to do? You have to position the patient, maintain sterile aseptic technique, and you have to give the local anesthesia agent to the doctor, and whatever things the doctor is asking, you have to be proactively act and give the things which is being required by the doctor. So chest tube insertion procedure, during that you have to give the doctor and local anesthetic agent and chest tubes of right sizes, and immediately as soon as the chest tube is put, you have to connect it to the drainage system, and you have to secure it meticulously. I am repeating, you have to secure it, because in order to prevent accidental delining of tubes, you have to secure it in a right manner. So probably doctor will put sutures, so you have to secure it properly. Then apply sterile dressing, and very important thing is confirm by chest X-ray. You need to confirm by chest X-ray. Why? Why we need to confirm it? Because sometimes the malposition can happen. Instead of putting it one position, it may go into some other direction. It may go some beyond, deeply into the lung parenchyma. Sometimes it will not even enter the pleural cavity. Such kind of situations may exist. It depends upon the competency of the consultant. So in order to verify that it is present in the pleural space, you have to confirm it by only by chest X-ray. Clear with the chest tube insertion procedure? Okay, fine. Next, here comes the important point: nurse's responsibility before procedure. Before ICD insertion, what is our responsibilities? You have to explain the procedure to the patient again and again. I am telling, and obtain informed consent. Check the investigation, especially your BTCT value, in order to prevent the patient have bleeding issues. So you have to check investigation, especially BTCT and all the basic HT level and all those stuff. Definitely you have to assess the respiratory status. So you have to check vital signs, and in that RR, respiratory rate, is very important. Prepare the equipment. You cannot go and run out of for things, so you have to prepare all the needed document articles at the bedside while you perform the ICD insertion. Monitor vital parameters, very important word. So very commonly we say vital signs, but we tend to do all 5 parameters. We tend to check all 5 parameters which is being present in the vital signs. We will do we'll check the BP alone and we will come back. That should not be done. You have to check all the parameters of the vital signs, especially the respiratory rate, as administered prescribed analgesics as per order. These are all the responsibilities you have to do, or you have to follow and do before doing the ICD insertion. Next is nurse's responsibility during procedure. During procedure is what? To maintain sterile technique, because the tube is going directly into the lung cavity. So how much sterile we have to maintain? So definitely you have to maintain sterile technique. We have to monitor oxygen level at every single point of time. Whether the patient is desaturating or patient is not in a good situation, immediately you have to notify to the doctor. So proactively you have to work on. Reassure the patient, observe for RDS, respiratory distress, assist the physician, and secure the drainage system. These are all some of the responsibility you will be doing it during the procedure. So nursing care after insertion. So after the ICD is being done. So what is the aftercare? You have to assess the breathing pattern. You have to check the pain level of the patient. observe drain amount and color. What kind of drain is been aspirated, either the bloody thing or the pus collection or the excessive fluid collection. So you have to check and assess the drainage amount and ensure tube is not kinked. And very important word is keep the bottle below the chest level. You can see it in the picture, right? So it should always, the bag or the drainage system container should lie just below the chest level of the patient. You have to not keeping it at the top or keeping it at the equal level. No, you should not do that. You have to always keep the drainage bag below the level of the chest. Encourage coughing and deep breathing exercise, and as much as possible you have to tell the patient to use incentive spirometry exercise. Okay. Then chest drainage assessment. How you have to assess the drain. So you have connected, you have put the ICD and the drainage also is coming and collecting. What are all the things you will assess in the drain? You will have to assess the color, you have to assess the amount, you have to assess the consistency, air leak any air leak is there or not, bubbling, tidalling, and record the findings at every shift. Clear? So all these parameters you need to assess. What else? So here comes some of the do's of the nurses. So what are the do's here? Secure all connection, very important. Though it has been sutured, the ICD tube has been sutured, we have to secure all the lines. You should not give chances for the tube to get pulled out or kinking and all the stuff. So you have to keep it in a secure manner. Maintain water seal correctly. Encourage patients coughing and deep breathing. Check the dressing for any wetness or oozing, etc. We have to monitor the SpO2 saturation level. Since we have done some procedure in the chest cavity, definitely you need to monitor the respiratory rate and the O2 saturation level and document the drainage reading in the nurse's record. So these are some of the do's to be done by our nurses. What are all the don'ts? So do not clamp routinely. You should not clamp the ICD routinely. Do not lift the drainage bottle above the chest level. So it should always lie at the below the chest level. Do not strip the tubing. What do you mean by stripping? So some setup what they will do, if the patient is having any blood collection and the tube is being connected with the bloody or clotted blood, they will do milking. They will put the strip and they will aspirate the chest drainage tube. That should not be done because we are giving injury to the lung trauma, lung parenchyma. The patient also will not feel ease when you do this stripping. Then do not disconnect unnecessarily. Do not ignore sudden increase in drainage system. So these are some of the don'ts. So what are the expected complications? Like some other procedure, this ICD procedure also has got some sort of complication. What are all the complications? Infection. If you follow any unsterile technique, definitely chances for infection complication will be there. So you need to be very, very careful. Removal of chest tubes. When you have connected the tube, you have secured it, everything you have done. So what is the next step? You have to plan for removal. When the removal can be planned? So when the lung is fully expanded. So daily you have to take chest X-ray in order to assess the improvement. So when the lung is betterly improved or there is improvement in the lung expansion, you can plan for this ICD removal. When there is no air leak from the lungs and the drainage is very minimal. So how the drainage will be in case of pneumothorax? Initially dark red or bright red bloody thing will come. Then parallelly, then slow by slow it will be reduced to sanguous, then zero sanguous. Then finally it becomes serious. Then that is the moment it indicates the color change has happened. So we can plan for this ICD removal. Physician order we need to check. Nurse should always explain the procedures, administer analgesics as per order, apply occlusive dressings, monitor the respiratory status of the patient. So all these part you have to do when you plan for this removal of chest tubes. Then patient education. So as soon as the ICD is put, you have to tell the patient not to pull the tube. They have to keep the tubes carefully. When they go out, they have to take the help from the nurses. Then they should avoid pulling the tube, or they should prevent the tube from kinking or pulling, etc. Report breathing difficulty. perform deep breathing exercises, then keep drainage system below chest level, and they have to always call up the nurses when they go out of the bed for any toileting or any other reasons. So this is the education you need to give to the patient. Then so far we have seen about the different aspects of this ICD. So what are the indication of this chest drainage system, in which are all the conditions they will do that, and what are all the articles we need to keep ready, and what are all the nurses responsibility before procedure, during procedure, after procedure, how this romosil system, the chest drainage chamber will work. As I already told, there are three things. One is the collection chamber, water seal chamber, and the suction chamber. So how each one works differently, and what are all the do's and don'ts which is involved in ICD insertion we have seen. So coming to the take-home message, we have to maintain a closed system. Like how we have maintaining closed system for IV, same way for chest drainage tube also we have to follow closed drainage system. Then keep the drainage unit below the chest level. Always, like how you keep the Euro bag below the bladder level or below the groin level, you need to keep this thing, drainage unit below the chest level. You should never clamp the chest tube routinely. Suppose you are going to empty the content, that time you can put some clamp for some times, and then you have to remove it immediately. Monitor for air leaks. Any air leaks is there or not, you need to check it meticulously. Record drainage accurately. For example, today 100 ml drain, so you have to remove, you have to record it very correctly, because every single entry done by you is also matters to plan for the patient's ICD room. So you have to, documentation plays a major role. You have to record it correctly and keep it, and encourage coughing and deep breathing exercises, and assess respiratory rate very frequently. So these are all the some of the take-home messages of this session. So hope this session is useful to you all. In this session, we have seen what is ICD, so what is chest drainage, so what are all the indication to do chest drainage, and which are all the patients we may plan for this chest drainage, and what are all the nurses' responsibility in arranging the articles, how we have to assist the doctor, how we have to document it, and we have seen some of the do's and don'ts in ICD or chest tubes and chest drainage system. Hope this session is useful to you all. Thank you.